So welcome everyone, and thank you for joining us at this important event for Bristol Hospital and Healthcare Group. So as you know, every day is extraordinary here, and today especially. I'm pleased to announce that we have signed a letter of intent with Vanguard Health Systems, a nationally recognized for-profit hospital network and a Fortune 500 company. But that's not all. They own 28 acute care and specialty hospitals in 5 states. So this will ensure that our commitment to care for patients and families in our communities will continue for generations to come. And it honors the long-standing heritage of Bristol Hospital, its mission, and its name. Becoming part of a high-performance integrated care network with new financial resources and clinical excellence will allow us to make major renovations to our main campus, to expand our outpatient services and capabilities, and to continue to attract top-quality physicians, nurses, and healthcare professionals. Financial details will be announced upon completion of a definitive agreement, which will be concluded within 60 days. In addition, today we are announcing that we have signed a new network agreement with Yale New Haven Health System to include the development of joint clinical programs, protocols for the transfer of patients for tertiary and quaternary care, and other network benefits.
It's a privilege to be here on behalf of Vanguard. 3 things I'd like to say. One is I would like to commend the partnership committee for getting to this point, not just for selecting Vanguard as their partner, but also for the process that they went through in selecting Vanguard. A very thorough process. They visited 4 of our 5 markets. We gave them access to physicians, local board members, and members of management to get a better understanding of what Vanguard was about and the way we operate. Second thing I wanted to say is that the process that Bristol has gone through to get to today is not unlike a lot of processes that are going on across the country. Many hospitals, in the wake of the change that's going on in healthcare, there's some certainty around healthcare, but there's still a tremendous amount of uncertainty, and access to capital for a lot of not-for-profit hospitals just isn't there. So this process is one that we're seeing a lot of, that you'll be seeing more of across the country. The third thing that I want to say is that we feel a lot of alignment with what Kurt and his team have been working hard to establish here. As a company, Vanguard is built on, and we believe that to be successful, to continue to be successful, that we have to be a high reliability organization, provide very safe environment, great quality care, and provide for great clinical outcomes, have a very engaged workforce, and work very closely with our physicians at all of our hospitals. This is the same path that Kurt is on and has been on here at Bristol, and we believe that we combined we can be very successful. Vanguard now provides Bristol the opportunity to leverage best practices and supported practices and data proven practices across the country from our 28 hospitals that we can now put into place here with the management team in certain situations to continue to improve and build upon what Kurt and his team have done here. So thanks again for having me, and I'll now turn it over to Kurt.
Thank you all for coming. This is truly an exciting day for this hospital. This journey that we took that started over a year and a half ago was a board-driven process. You can be assured that the community's best interests were always first and foremost as the decisions were being made. And truly the mission of this hospital is safe with this transaction as we move forward. The partnership committee, the board of directors, traveled far and wide, and as you heard Rob and Marie both say, we visited hospitals across this country, in Detroit, in Chicago, in Texas, and many other places, Massachusetts. And this will essentially put us in as part of a larger system in New England, which will comprise the hospitals that are currently Vanguard hospitals in Massachusetts, and also with Waterbury Hospital in Waterbury. So a lot of questions today about how we think about that and what does that really mean. We've had several employee forums this morning, and most importantly, we also had a physician forum early this morning at 7:30. We actually signed the agreements on Monday, and we made a commitment to our staff that we would communicate with them first before we actually did the public release of information. So a lot of questions about how the system will work here and what will the employees see that's different. The one thing you can be assured of is the tradition of Bristol Hospital will be maintained. In fact, you will likely not see anything different on the front door. It will continue to say Bristol Hospital. The employees that are here will be here. The transition hopefully will be seamless. I think, as Marie indicated, there's a long legal regulatory approval process, but what you see and you feel in terms of the family that takes care of the patients of this community will be here for generations to come. That's our understanding. Marie mentioned the financial details will be disclosed at a future date. There is clearly going to be an investment in this community hospital. And those details will be worked out over the next 60 days, and it will engage our board in a strategic planning process with the executive leadership of the Vanguard system. So we're really excited about that. And as we make the filings, a lot of that information will become public. The initial response from the employees of this room was packed this morning. I commented that when I have my employee town hall meetings, I wish I had that kind of attendance. There was standing room only in this room. And so far we've had good positive feedback from the employees. The expectation is that as part of a regional system, we will work together to achieve success under the new payment reform models, the Affordable Care Act. Vanguard has extensive experience in this. As a community hospital, as community hospitals across this country are now struggling with this whole concept of taking risk, taking bundled payments, the things you hear about, talked about in a real sense, it would be difficult to imagine that a hospital this size would have the resources and the talents necessary to compete effectively in that world or perform effectively in that world. Vanguard Health System has several insurance companies. They offer a Medicare plan, a Medicaid plan in 2 states, and they have a Medicare Advantage plan. And they have a pioneering ACO, which was awarded recognition by the Medicare Center for Innovation. So in a real way, we essentially take a tremendous step forward through this relationship, through this change in the way we're owned and operated. We don't have those resources, and this partnership will bring them to your local level. And so you can expect some really great things from this relationship. A lot of questions this morning about how we would relate with Waterbury Hospital. It will essentially be part of the same family. Vanguard was our first choice, our top choice, a unanimous choice of the partnership committee. And in addition, it was a unanimous decision by the board of directors. So we are really excited and pleased that we got our first choice. So Rob, thank you for that. Thank you very much.
We are good corporate citizens. We embrace the communities in which we enter, and we become a part of it. As Kurt has mentioned, the hospital name will remain. Vanguard, you won't see much of the Vanguard name around here, and that's by design. That we want to be good community citizens, and we have proven that over and over again. That was part of the diligence which the partnership committee undertook, and I think they found that was very consistent across all of our markets.
The medical staff meeting that we held this morning went very, very well. I think physicians were quite excited. I saw a lot of smiles, a lot of nodding of acknowledgement. I think this will be really good for Bristol Hospital and the medical staff. We're going to be able to expand on our clinical programs and also be able to recruit highly qualified physicians. I think this is a really good thing for Bristol Hospital. Thank you.
We really appreciate your being here. This doesn't stop the extraordinary days that are going to occur. And we hope that if you have any other questions that come to mind, that you let us know. Obviously, we still have some work to do, but we are very excited about being here and excited that you were able to join us this morning. Thank you.
Thank you very much.